We were talking about being a midwife and exactly what a midwife is. And you were just starting to explain to us what your position is and what most midwife positions are. Why don't you go ahead and finish telling us about that?
Right. So what I am is a certified nurse midwife. That's where you've been a registered nurse in the past. So you go back for additional schooling. It's usually a master's degree, much the same as a physician's assistant or a different type of nurse practitioner. A certified nurse midwife is actually a type of nurse practitioner, but we're specifically trained in women's health and prenatal care and attending normal deliveries.
Okay, and I think that's one of the things that we hear a lot about. We hear about the deliveries that a midwife basically will perform. But you also can do some prenatal care, and then there's some aftercare and just some general women's health issues and concerns that you actually work with women on as well. Tell us about those.
Exactly. So a woman could come to a midwife for their routine care, their yearly exam, pap smears, breast exams, being screened for cholesterol, diabetes, any kind of maintenance care that a woman needs could be provided by a midwife.
Okay, and I think a lot of times, you know what, we don't think of a midwife in those terms. We think of a midwife only if you're pregnant, but not necessarily the case. If you do have other testing or things like that that you need done, a midwife is an option for a lot of women.
Right, and because most women are healthy and they're just going in for the routine screenings, it's great to be able to get into a midwife who can focus a little bit more time on explaining health maintenance, different screenings and exams that you might need. And midwives are really trained to recognize things that are out of the normal pattern.
Okay.
And so we're definitely able to refer to a specialist or a doctor if we find anything that's not normal. And we work really closely with other specialists in that case.
Okay, now are there particular types of ailments, female related, that you might say, well, a midwife will be perfect for this, or are there things that you would stay away from? Can you give us an idea of that?
Well, and different midwives might be more specialized in different areas.
Okay.
Certain midwives might work more with like premenopausal women and working with hormones and things like that, or some midwives might be more comfortable working with women with diabetes. But we, as a group, specialize in just normal, healthy women and and helping them to maintain their health.
Okay, and I think that's what's important. Now, how do you determine a midwife is a good option for me as a woman? I'm not expecting. How would I determine that, you know what, this may be the option versus just my normal OB/GYN or my GYN that I would typically attend to?
So if you're just looking for some normal health maintenance, so you need to go in for your yearly exam, you haven't had a pap smear for a while, you wanted to be screened for a sexually transmitted disease, or you wanted to make sure your cholesterol wasn't high, or you didn't have diabetes, those are all things that a midwife could screen for.
Okay, and now do you write the prescriptions and things like that just as a normal doctor would if necessary? Or?
You're able to order lab tests or other tests if they're needed. You can write prescriptions. Definitely make diagnoses, things like that.
Okay, and one of the great things is that this is a program, or midwives are available here in Park City. And how do we find out about having a midwife if that's the option that we choose?
You can go to the American College of Nurse Midwives website that definitely, I think, has a list of midwives in the area. And then I currently am working at the People's Health Clinic, where we do prenatal care specifically for women without insurance.
Oh, okay, all right. So there is that availability at the People's Health Clinic as well for people here locally in Park City. All right, that's fantastic. And would they just come in, or would they ask for Annette Johnson and be able to make an appointment to get in to see you, or?
Well, we specifically do a prenatal care for women without insurance, just because that group of women tends to put their prenatal care off until the last part of their pregnancy, or maybe doesn't have prenatal care at all. They just show up at the hospital to deliver.
Okay.
And it really makes such a difference for the mom and the baby if they can get good prenatal care from the beginning of their pregnancy, and we're able to offer that there.
Well, I think that's a great idea. Thanks so much, Annette, for being in this morning. We appreciate it. And again, if you're interested in a midwife, you know what? It's available to you. You can check the website again is, the American...
acnm.org.
Okay, acnm.org for more information about midwifery. Or if you are a pregnant woman and you're looking for a midwife, People's Health Clinic is a great option for you, especially if you are not insured at this particular time.